بسم الله الرحمن الرحيم. محاضرتنا اليوم تتعلق ب cardiovascular system أو dental management for cardiovascular diseases. The cardiovascular system consists of two parts, the heart and the blood vessels. The heart is the muscular organ that have myocardium. It consists as two parts. The upper part is the atrium. We have right and left atrium, and lower part the ventricle, right and left ventricle. The separation between the atrium and ventricle by valve, and the left side, the left atrium and left ventricle by mitral valve, bicuspid valve, but in right atrium and right ventricle separated by tricuspid valve. The blood within the left side is oxygenated blood. The blood within the right side is deoxygenated blood. The vessels that connection to the left ventricle is the aorta, the major artery in the body. At the left atrium by pulmonary veins that carry oxygenated blood from the lung. On right ventricle, we have the pulmonary artery that carry deoxygenated artery to the lung. But on right side, we have superior vena cava and inferior vena cava that carry from the deoxygenated blood from all body to the heart. This figure shows the two atrium, right and left side, and two ventricle that are lined by the endothelium, and we have valves that connection by the fibers to be in one direction, open from the atrium to ventricle. This figure shows how pulsation, the contraction of myocardium, and formation of impulse that carry the blood by contraction from left ventricle and left atrium to the body and to the lung, and when be in rest condition that carry the blood from the body to the right atrium and from the lung to the right left atrium. The second part is the vessels. We have three sets of vessels. The first one called the artery that carry the oxygenated blood, and the color is red. And second one, the vein that carry deoxygenated blood and carry the and this color is blue. The other set is capillaries that connect the artery to the vein. The anatomy of the artery is a tube shape, carry the blood that consists RBC, white BC, and the platelets. The veins that have the deoxygenated blood that have a valve to prevent return the blood from downward to upward that have not returned by its relaxation of the heart. The difference between artery and vein, the structure, the thickness of the wall is thicker in the artery than the vein. The muscular layer is thicker. The diameter of the internal lumen in the artery is smaller than the vein, is larger. We have elastic fiber is thicker in the artery than the vein, and only present the valve in the vein, except the head and upper part of the chest. The other set is the capillaries that connect the artery to the vein through minute microscopic blood vessels that have exchange of oxygen and CO2 and food material that enter from the blood to the tissue and carry the waste material from the tissue to the blood and the CO2 from the tissue to the blood and become vein and collection, a venule, and continue to form a vein. This figure shows the cardiovascular system from the heart. We have two circulation, the pulmonary circulation and systemic circulation. The systemic circulation is the carry the oxygenated blood from the ventricle through the aorta and divert and continue as artery to arteriole to arterial capillaries, and then the oxygen go to the tissue and take the CO2 and forming the capillary venule and veins, and the formation of the two major veins is the superior vena cava and inferior vena cava to the right atrium and to right ventricle. From right ventricle, the pulmonary circulation that form the pulmonary artery that carry the oxygenous blood to the lung, and in the lung the CO2 go outside and enter the O2 and formation of oxygenated blood through pulmonary vein and go to left atrium and left ventricle, and this complete the circulation. We have other circulation, the parietal circulation that go from a vein to vein, not go through the heart. The ECG, electrocardiography, that have the formation of cardiac muscle impulse. Now we start with the first and very important disease is the hypertension. Hypertension is the in general aspect, blood pressure is maintained by the cardiac output and vascular resistance. المحافظة على البلاد بريشر من خلال الكاردياك output and the type and feature of vascular blood vessel through vascular resistance. The vascular resistance largely depends on vascular capacity and the tone. تعتمد الresistance على capacity of the blood vessel and the tone of contraction of the muscle, smooth muscle within the blood vessel. The vascular tone is a balance between converting vasoconstrictor and vasodilator molecule. توجد في البلاد نوعين من molecules هي أولا vasoconstrictor to contract the smooth muscle and vasodilator to dilate the smooth muscle, and this concentration that give the tones of the vessels. The most potent vasoconstrictor is endothelium 1, released by vascular endothelium in response to expansion to plasma volume and hypoxia or growth factor, which regulate vascular tone. تعتمد الفاسكولار تون على عدة انزيمات أو عدة فاكتورات، هي في حالة نقصان الأكسجين أو وجود growth hormone أو increase plasma volume that lead to have more endothelium that excrete endothelium 1 and lead to vasoconstrictor. The blood pressure is easily measured by convention in the right arm with a sphygmometer. Since the blood pressure rises with anxiety, measurement should be made with the patient relaxed and fully at rest. That the blood pressure is lowest at night and highest first thing in the morning. حقيقة ضغط الدم تزداد في حالة anxiety and psychological factor. فلهذا يجب على المريض أن يكون في rest condition to measure the blood pressure. This figure shows a sphygmometer that put in the upper arm above the scaphoid fossa and measure the blood pressure. This figure shows that put the sphygmometer and put the stethoscope to measure the blood pressure. What means hypertension? Hypertension is a persistent rise in blood pressure resulting from right peripheral arterial resistance, but the definition in terms of blood pressure of what is hypertension is arbitrary. In general, the blood pressure rise with age. البلد بريشر عند البالغين أكثر لوجود قلة التون and نقصان قطر of the blood vessel خاصة الارتري. When either or both systolic or diastolic pressure are persistently raised and on remeasurement with systolic pressure over 140 and diastolic over 90 mm mercury is generally regarded as hypertension. About 20% of population are by this measure as hypertensive. حقيقة السيستوليك هو that measure the blood pressure in the center of the heart, and the diastolic is the measure of blood pressure at the periphery in the capillaries. So, when the blood pressure increases than 140 over 90 mm mercury, that patient is hypertensive. About one-third of people with hypertension are unaware of it, and of this under treatment only about one-third are fully complemented. حقيقة ثلث الذين عندهم hypertension وما يعانون من أي أعراض، والثلث اللي هم يأخذون علاج. In practice, the diagnosis of hypertension that require active treatment is often made when the blood pressure at rest exceeds 160 over 90 mm mercury as systolic and diastolic, but the level of blood pressure at which intervention is indicated are varying, as study shows the benefit of keeping the blood pressure at near normal, the ideal of less than 140 over 80 mm mercury. The hypertension predisposed to damage to heart, kidney, brain, eye. إذا حدث أي تأثيرات على هذه الأعضاء راح يكون patient عنده متعرض للhypertension. Hypertension, if untreated, shortens life by 10 to 20 years. It accelerates atherosclerosis and leads to morbidity and mortality from ischemic heart disease, stroke, peripheral vascular disease, and renal sequelae. حقيقة ارتفاع الضغط يأثر على حياة الإنسان إلى قد يقلل من عمر الإنسان. سببه هو وجود atherosclerosis بالارتري. هذه راح تؤذينا إلى الهارت، قلة الدم يورد إلى الهارت تؤدينا إلى ischemic heart disease and stroke to the brain and peripheral vascular disease to the periphery وخاصة upper fingers and renal problem through renal artery. The risk of sequelae is greater in diabetes and cardiac or renal disease. في حالة diabetic patient or cardiac disease or renal disease تؤدي إلى increased hypertension. And more than 90% the causes of hypertension is unknown. It is then termed essential hypertension. معنات essential hypertension, there are no cause for the increased blood pressure, which becomes more frequent as age advances and appear to be related to genetic influence, obesity, and various other factors. حقيقة etiological factor for essential hypertension هو أهم شيء هو genetic influence, and other thing the obesity, increase in the body weight, and other factors that lead to essential hypertension. About 40% of hypertensive patients have raised level of circulatory catecholamine, epinephrine, or norepinephrine, and may therefore have abnormal symptomatic activity. Treatment with antihypertensive drug is generally beneficial. في حالة abnormality in sympathetic activity خاصة الأدرينالين noradrenaline and other catecholamine تؤدينا إلى increase in blood pressure. العلاج بالأنتي hypertensive drug مهم ومفيد. Hypertension may be secondary to definite causes such as renal disease, endocrine disorder, pregnancy, or oral contraceptive, but in only about 10% of patients. حقيقة 10% من المرضى بالهايبرتنشن لأسباب أخرى مثلا renal disease, endocrine disorder, like thyroid hormone increase, or in pregnancy, or female taking oral contraceptive. The etiological factor of hypertension, the causes of hypertension: first, idiopathic as essential hypertension. Second is secondary hypertension due to renal disease, renal artery disease, pyelonephritis, glomerulonephritis, polycystic disease, post-transplant. Other secondary hypertension, like in endocrine diseases. Other one, Cushing's syndrome and corticosteroid therapy. Hyperaldosteronism, pheochromocytoma, acromegaly, cerebral disease like cerebral edema, mainly stroke, head injury, or tumors. Other one is coagulation of aorta, hypertension upper half of body only. Other etiological factors, the drugs, sometimes illicit drug, cocaine, amphetamines, or prescribed drug, immunosuppressive drug, glucocorticoid, mineralocorticoid, anabolic steroid can raise the blood pressure. Some non-steroidal anti-inflammatory drugs like indomethacin can impair the efficiency of antihypertensive agent. We have other categories of hypertension called malignant or accelerated hypertension. Is uncommon. It can have an acute onset or can develop in pre-existing essential hypertension. Hypertension is complication can be modulated by various lifestyle factors. This factor lowering the blood pressure and factor rising the blood pressure. The factor that lowering the blood pressure, no obesity, low salt intake, low alcohol intake, stopping smoking, physical activity, relaxation, high fiber diet, omega-3 fatty acid, fruit and vegetable, supplemental potassium. The factor that rising blood pressure is obesity, high daily salt intake, excess alcohol, smoking, physical inactivity, stress, and anxiety. What's the clinical feature of hypertension? Uncomplicated hypertension causes either no symptom or triple complications such as epistaxis. حقيقة في بداية الهايبرتنشن هو epistaxis mean that blood from nose. Hypertension affects the brain, heart, eye, kidney with complications that include particularly MI, myocardial infarction, or stroke. Hypertension, particularly when associated with atheroma, is a major cause of stroke, cerebrovascular accident, as a result either or hemorrhage into the brain from rupture of any artery or of thrombosis complicating an erythematous plaque that formation. Coronary artery diseases, heart failure, persistent hypertension lead to cardiac hypertrophy until the heart outgrows its blood supply and fails. If atheroma, atherosclerosis of the coronary artery develop, concurrently the heart blood supply shrink even further. A common result is angina pectoris or myocardial infarction. Retinal damage, the retinal hemorrhage, retinopathy or optic neuropathy, that complication of the eye. Complication of the kidney lead to renal disease. In addition to contributing to atherosclerosis, hypertension causes thickening of the wall of the arterioles of the kidney, and this may lead to ultimately to renal failure. Hypertensive nephrosclerosis is the term given to long-term essential hypertension. Hypertensive retinopathy, left ventricular hypertrophy, minimal proteinuria, and progressive renal insufficiency. Malignant or accelerated hypertension typically affect young adults, like essential hypertension, causes no symptom until complications develop. The chief complication is serve as ischemic damage to the kidney and renal failure. There is rapid deterioration in renal function in the absence of treatment. It can be fatal within 1 year of diagnosis. Other causes of death are cardiac failure or cerebrovascular accident. However, vigorous treatment, if started before renal damage is too far advanced, can really improve the life expectancy. About 50% of such patients can now expect to live for at least 5 years. Both pain, the threshold, and tolerance are higher in hypertensive than non-normotensive subjects. The mechanism is unclear, but drug treatment of hypertensive normalizes the pain prescription. The factor of hypertension have symptom and sign of hypertensive patient. The symptom is headache, visual disorder, tinnitus, dizziness, and angina. The sign, hypertension on testing, retinal changes, left ventricular hypertrophy, proteinuria, and hematuria by laboratory investigation. How we manage the patient? The acute emotion, particularly anger, fear, and anxiety, can cause great rise in catecholamine output and transient rises in blood pressure, and should therefore be avoided or controlled. Even for mild hypertension, lifelong treatment is usually necessary and include relaxation, weight loss, reduction in salt intake, restricting alcohol consumption, restricting caffeine intake, stopping smoking, more exercise. Treatment, we have specific antihypertensive therapy is urgently indicated where the systolic pressure exceeds 200 millimeter mercury or diastolic increase than 110 millimeter mercury and may be indicated at lower level, particularly if there are vascular complications, diabetes, or end organ damage such as renal impairment. The goal of antihypertensive therapy is to use the minimum dose of drug commensurate with achieving the desired blood pressure, currently optimal at less than 140 over 80 millimeter mercury, and with minimal adverse effect. The drugs that use as a hypertensive drug is first group diuretic, second group angiotensin converting enzyme inhibitor, third group angiotensin 2 receptor block, fourth group beta adrenergic blocker, fifth group calcium channel blocker, and last one alpha adrenergic blocker is less commonly. The diuretics such as bendroflurazide are commonly used in the first instance. Angiotensin converting enzyme inhibitor such as enalapril or perdinopril are now commonly used as first-line antihypertensive therapy. Their main drawback is that the patient may develop a cough. Calcium channel blocker are now also commonly used as first-line drug but can cause peripheral edema. Adrenergic inhibitor, particularly beta blocker, are the usual first choice of additional drug but may cause bradycardia and should not be used in patients with asthma or chronic obstructive pulmonary disease. Atenolol is the main beta blocker used, but many others are available. Alpha blocker may also be used in treatment of hypertension. This figure shows the table, the group of table, and a very example and common and adverse effect and possible oral effect. Like first, the alpha adrenergic blocker, example doxazine, tirazine, the side effect in the oral cavity, dry mouth, and angiotensin converting enzyme inhibitor as corporolol, inaprolol is first drug may cause sudden fall in blood pressure, and its oral activity side effect is burning sensation or ulceration or less of test, angioedema, sinusitis with quinapril and lidocaine reaction. Angiotensin 2 receptor blocker like contraindication, zartine is lead to a side effect in the oral cavity is facial flushing. Beta adrenergic blocker like exoplanol and atenolol, it may cause a bronchospasm contraindication in asthmatic patient. Its oral side effect, dry mouth, lichenoid lesion, and paresthesia. Calcium channel blocker, amlodipine, diltiazem, this lead to headache and flushing, swollen leg. The oral side effect, gingival hyperplasia, most with the nifedipine. 30% are affected, salivation with nicotapine. Other group, central acting antihypertensive drug like clonidine, and its oral side effect, dry mouth. Potassium channel blocker like nacrodil lead to headache, may cause flushing, and its oral effect is ulceration. How dental management of patients with hypertension. We classify the blood pressure in systolic blood and diastolic in four groups. The first group is below the 140, below systolic and below 90 in diastolic is ACA grade 1 is hypertensive, no hypertensive, and routine dental care use. The blood pressure between 90 to 140 and 140 to 949 as systolic and 90 to 99 as diastolic is as ACA. Grade 2 is a first stage of hypertension. Is risk blood pressure before starting routine dental care. The systolic blood pressure between 160 179 and systolic and diastolic 95 to 109 is ACA. Grade 3 is hypertensive. Stage 2 is risk blood pressure before starting medical advice before routine dental care. Restrict use of epinephrine and conscious sedation may help. More than 180 to 1 more in systolic and more than 110 in diastolic is ACA. Grade 4 is stage 3 hypertension. Is risk blood pressure after 5 minutes quiet rest. Only emergency care until blood pressure controlled. Medical advice before routine dental care. Avoid vasoconstrictor. Patients with stable hypertension may receive dental care in short, minimally stressful appointments. It is essential to avoid anxiety and pain since endogenous epinephrine released in response to pain or fear may induce dysrhythmias. Dental management can be complicated since the blood pressure rises even before visit for dental care. Preoperative reassurance is important, and sedation with 10 mg timavazine may be helpful. Patients are best treated in the last morning. Endogenous epinephrine level peak during morning hours, and adverse cardiac events are most likely in the early morning. Continuous blood pressure monitoring is indicated. Rising in the patient suddenly from supine position may cause postural hypertension and loss of consciousness if the patient is using antihypertensive drugs such as thiazide, furosemide, or calcium channel blocker. Management of hypertension patient may also be complicated by diseases such as cardiac or renal failure. Systemic corticosteroid may raise the blood pressure, and antihypertensive treatment may have to be adjusted accordingly. Some non-steroidal anti-inflammatory drugs like indomethacin, ibuprofen, and naproxen can reduce the efficacy of antihypertensive agents. The local anesthesia is not contraindication in hypertensive patients unless the systolic pressure over 200 mm mercury and or diastolic over 110 or 115 mm mercury. Epinephrine adrenaline-containing local anesthesia should not be given in large dose to patients taking beta-blocker, since interaction between epinephrine and beta-blocking agent may induce hypertensive and cardiovascular complications. General anesthesia. All antihypertensive drugs are potentially by general anesthesia agent, which can induce hypotension. This is especially the cases of barbiturate and opioid. Dangerous hypotension can result. Intravenous barbiturate in particular can be dangerous in patients on antihypertensive therapy, but halotene, influence, and enzoflurane may also cause hypotension in patients on beta blocker. However, antihypertensive drugs should not be stopped since rebound hypertension can result. Hypertension may be a contraindication for general anesthesia if a complication by cardiac failure, coronary or cerebral artery insufficiency, renal insufficiency. Chronic administration of some diuretics such as furosemide may lead to potassium deficiency, which should therefore be checked preoperatively in order to avoid dysrhythmias and increase sensitivity to muscle relaxant such as Coronary, galamine, and pancramine. The facial palsy is an occasional complication of malignant hypertension. Antihypertensive drugs can sometimes cause orofacial side effects such as xerostomia, salivary gland swelling or pain, lichenoid erection, erythema multiforme, angioedema, gingival hyperplasia, sore mouth, or paresthesia. Other important disease that is coronary ischemic heart disease. The term atherosclerosis or atheroma or arteriosclerosis is a common disorder that underlies ischemic heart disease and stroke. أهم سبب للإسكيميك هارت ديزيز هو نقصان كمية الدم that supply to myocardium. هذه تؤدي إلى أنه the coronary artery is reduced inside by a deposition of lipid that lead atherosclerosis or called atheroma. The atherosclerosis is caused by accumulation of lipid in the arterial wall due to a variety of factors. The atherosclerosis can lead to vascular thrombosis, clot, which sometimes break off and move within the vascular, lead to called it embolism. The atherosclerosis can affect many blood vessels with different results. This figure shows the accumulation of lipid within the arterial wall that lead to narrowing of the artery. The sites that have lead to atherosclerosis, the first one, coronary artery. The consequence, coronary artery disease, possibly clinical syndrome, impairs oxygenation and can lead to chest pain and as angina. The second artery, cerebral artery. This leads to cerebrovascular disease that lead to stroke. The last artery, peripheral artery, lead to peripheral vascular disease, and this possible clinical syndrome, impaired oxygenation, pain, intermittent claudication, and sometimes gangrene. General aspect of chronic ischemic heart disease is due to occlusion of the coronary artery, usually by atherosclerosis. This figure shows the coronary artery is reduced the size by accumulation of lipid within its lumen. We have two types of ischemic heart disease. The first one called angina pectoris, pain arises from myocardial oxygen demand exceeding the supply. Insufficient blood flow to the heart muscle from narrowing of coronary artery may cause chest pain that have called angina pectoris. Second one is myocardial infarction, MI. Infarction, if severe, causes acute failure of all circulation, loss of cerebral blood supply, and often death. الانفاركشن معني انه all the lumen of coronary artery is closed by the atherosclerosis that no blood supply and lead to death of myocardium. Atherosclerosis is a disease predominantly of male, particularly of affluent societies linked to some smoking, lack of exercise, hypertension, and hyperlipidemia. There is a genetic component in some. There is a higher incidence of ischemic heart disease in patients with diabetes mellitus, hyperlipoproteinemia, hyperlipidemia, and hypothyroidism. Hyperlipidemia and hypertension seem to link and immigrant from the Indian subcontinent have a higher than average morbidity and mortality from ischemic heart disease. The primary risk for ischemic heart disease is high lipid density, low protein. Second lead to hypertension in smoking. The secondary risk factor, low high density lipid, is diabetes, obesity, family history of chronic heart disease, physical inactivity, type A personality, gout, ethnic and Asian, male gender, increasing age, low social class, chronic renal failure. Unclear factor, low dietary fiber, soft water, high plasma fibrinogen, rise blood factor 7, rise lipoprotein level. Protective factor, rising HDL to LDL ratio, more exercise, moderate red wine or other alcohol. Cardiovascular risk factors include male gender, post-menopausal women, oral contraceptive, low risk, age over 45 years for men, 55 years for women, race high in African and Asians, lifestyle, tobacco, smoking, very high risk, lack of physical exercise, obesity, and diet tours. This figure shows that how formation reduced in size of the artery by the deposition of lipid and formation of atherosclerosis. Low socioeconomic status associated high risk of chronic heart disease because of unhealthy lifestyle, particularly excessive smoking, hypertension, diabetes, genetic factor, family history, affected male relative under 55 year, female under 65 year, blood clotting disorder, plasminogen activator, homocysteine, common but of controversial importance, hypercholesterolemia, high risk, and other dyslipidemias. The blood cholesterol. The dietary fat is processed by the liver to form four main lipoproteins: chylomicron, very low density lipoprotein, low density lipoprotein, high density lipoprotein. Cholesterol may be right. Genetically, high blood cholesterol can run in families with increasing age in both sexes. Before the age of menopause, women have lower total cholesterol level than men of same age. After the age of menopause, women low-density lipoprotein level tend to rise by inactivity and being overweight, by low fruit and vegetable diet, by smoking, by other diseases such as hypertension and diabetes. High blood cholesterol itself causes no symptom, and many people are unaware that their cholesterol level is too high. Lifestyle habits recommended for lowering the risk of ischemic heart disease. The first, healthy weight, stopping smoking, moderate alcohol consumption, regular exercise, brisk walking for at least 30 minutes, fresh fruit and vegetable intake of at least 5 servings a day, grain intake of at least 6 servings a day with at least and 1/3 whole grain. This figure shows the factors that lead to high risk of chronic obstructive pulmonary disease, chronic ischemic heart disease. The clustered risk factor, the elevated inflammatory mark, reproductive hormonal variability, subclinical atherosclerosis, angina, and microvascular and endothelial dysfunction, myocardic ischemia, diastolic and systolic dysfunction, reduced functional capacity, lower rates of guideline therapies, knowledge gap of 6 septic of ischemic heart disease therapeutic starting. The clinical feature, the myocardial infarction differ from angina in that it causes more severe and persistent chest pain. Pain is not controlled by rest. It leads to irreversible cardiac damage or sudden death. The first one is angina pectoris. The angina type of chest pain, pressure, or discomfort. Heart is not receiving enough oxygen due to narrowed coronary artery. The diagnosis of ischemic heart disease, the first by history, second ECG, and third coronary arteriography as angiography. This figure shows the ECG for patients have ischemic heart disease. This is figures of radiology, the angiography of the heart. Treatment. The drug used include antiplatelet drug, aspirin or clobetasol to prevent thrombosis. Second, beta blocker, atenolol, metoprolol, etc. to lower blood pressure. Third, angiotensin converting enzyme inhibitor, enalapril, fosinopril at lower peripheral resistance and cardiac workload and hence blood pressure. Statin to low blood cholesterol, pain relief, and prophylaxis of angina is with nitroglycerin. Glyceryl nitrate is 0.3 to 0.6 nanogram sublingually during attack or before anticipated physical activity or stress. Long-acting nitrate, isopride, dinyptride may help prevent attack. The dental management for patients who have chronic ischemic heart disease. The stress, anxiety, exertion, or pain can provoke angina. Patients should receive dental care in short, minimally stressful appointment. Patients are best treated in the morning. The effective painless local anesthesia is essential. Epinephrine-containing local anesthesia should not be given in excessive dose to patients taking beta blocker. Gingival retraction cord containing epinephrine should be avoided. Conscious sedation should be deferred from at least 2 to 3 months before patient with myocardial infarction, recent onset angina, unstable angina, or recent development of bundle branch block, and in any case it should be given in hospital. General anesthesia should be avoided whenever possible and at least deferred for 3 or more than a month after heart attack. Angina can rarely cause pain in the mandible, teeth, or other oral tissue. حقيقة بداية الألم of angina ليس في الصدر ولكن يبدأ بالleft side of the mandible. And when manage this, we can discover by send to the physician and take ECG to see if there are any problems. The group of drugs that given, like alpha blocker, is example rosacaine and possible reaction or elastic hypotension. Alpha beta blocker, cardivolol, enhance pressure response to epinephrine. And ACE inhibitor like anabolol, indomethacin impairs. Anti-dysarrhythmias, disaboromide, and other group that lead erythromycin enhance bleeding tendency, bleeding. This is by clopidogrel is bleeding tendency, and epitifibatide leading to bleeding tendency. Beta blocker that have nadolol enhance pressure response to epinephrine. The digital glycoside is various local anesthesia vasoconstrictor may induce dysrhythmia, gauge reflex increased. Statin, various erythromycin and clarithromycin increase risk of muscle damage. Other diseases that is very important is congenital heart disease. In general, aspect of congenital heart disease is malformation of the heart structure. Congenital cardiac anomalies are now the most common type of heart disease among children and in developed countries are considerably more prevalent than arrhythmatic heart disease. Congenital heart disease is present about 1% of live birth, and in absence of treatment, possibility 4% of would die within the first 5 years. Congenital defect can involve the heart or adjacent blood vessel, and defect can be associated with different combinations. Some 20% of patients have other congenital anomalies. Midline defects are often multiple ventricular septal defects, for example, may be associated with cleft palate or imperfect anus. We have divided the congenital heart disease to 2 categories, the cyanotic and acyanotic. The cyanotic congenital heart disease, like transposition of great vessels, tetralogy of Fallot, Ischaemic syndrome, tricuspid atresia, pulmonary atresia. Acyanotic, that have ventricular septal defect, arterial septal defect, patent rectus arteriosus, correction of aorta, pulmonary stenosis, mitral valve prolapse, aortic stenosis, bicuspid aortic valve. The cyanotic type that have the deoxygenated blood go within oxygenated blood, but acyanotic, the patient have a normal condition. The cyanotic congenital heart disease defect are those where there is right to left shunting and are in general more severe. Defect is blue babies, can be lethal or life-threatening and lead to cardiac failure. That have low oxygen level in the blood causes the lip, finger, and toe to look blue as a blue babies. The causes of congenital heart disease are mostly unknown, but the main acquired causes are congenital rubella or cytomegalovirus infection and mitral drug misuse. There are syndromes that lead to cyanotic heart disease, like Down syndrome. That defect is arterial septal defect, ventricular septal defect, mitral regurgitation. Ehlers-Danlos syndrome, mitral valve prolapse. Friedreich is hypertrophic cardiomyopathy, wholly owned arterial septal defect and ventricular septal defect, inflator arterial septal defect, Marfan mitral valve prolapse, aortic regurgitation, Noonan arterial septal defect, pulmonary stenosis, Turner that co-irrigation, William supravascular aortic stenosis. The congenital heart disease that have a tetralogy of Fallot. Corrected transposition of greater artery that is changed, it can be termed as a twist of greater vessel or twist of ventricle, right and anterior aorta. Plane of the right ventricles is perforated frontally. Right ventricular supports systemic circulation. The ventricular septal defect, there are defects between right and left ventricle, so the blood can go from oxygenated to deoxygenated blood, and that is lead to an cyanotic heart disease. The arterial septal defect that have a presence of the defect between right and left atrium. The patent ductus arteriosus, that connection between the right and left pulmonary artery and pulmonary vein that is stay after delivery. Corrugation of aorta, that is the aorta is not in its position, that have not in right left ventricle but present in right. Prolapse mitral valve that have the not closed the valve if correctly, but it's not have complete closed, so there are continuous that the blood from right ventricle or left ventricle to right and left. That figure shows the pulmonary stenosis, that is the pulmonary valve that have become more thick, not have complete close. The aortic valve stenosis, that aortic valve become thick and not complete close. The bicuspid aortic valve disease and bicuspid valve stenosis or prolapse. The clinical feature of congenital heart disease. The most striking feature of some type of congenital heart disease is cyanosis, caused by more than 5 gram reduced hemoglobin per deciliter of blood. It results from shunting deoxygenated blood from right ventricle directly into left side of the heart and the systemic circulation right to left shunt, leading to chronic hypoxemia. In severe cases, cyanosis is obvious at birth, particularly in palate tetralogy. Chronic hypoxemia causes severe impaired development and often gross clapping of finger and toes. Patient might crash in an effort to improve venous return, but eventually polycythemia develop, hemorrhagic or thrombotic tendencies may result. This figure shows the clamping of the finger in cyanotic heart disease. Pulmonary hypertension and usually right ventricular hypertrophy may be seen where the shunt in opposite direction, left to right shunt. Some of output of left ventricle is recirculated through the lung. The direction of the shunt may eventually reverse and cyanosis develop later. This figure shows the left side hypertrophy of the heart in chest X-ray. Patients with congenital cardiac defect are often liable to infective endocarditis and other complications. The general management of patients have congenital heart disease. The medical treatment is needed for complications such as cardiac failure, polycythemia, infective complication, emotional disturbance. This needs a medication for treatment. Antibiotic cover may be required for dental and other operations with the aim of preventive infective endocarditis. The prognosis for patients with congenital cardiac anomalies has been enormously improved by cardiac surgery. Some cardiac surgery may leave residual defect that can predispose to infective endocarditis. How dental management patients have congenital heart disease. Susceptibility to infective endocarditis, but this is only statistical significance, and antimicrobial prophylaxis needed before dental surgery in all such patients. There may be bleeding tendency caused by palatal dysfunction and excessive fibrinolytic activity. Occasionally there is thrombotic tendency. A special hazard in some type of congenital heart disease is the development of cerebral abscess, which is very occasionally due to dental bacteria. Leukopenia may be a factor in some right-to-left shunts. Associated problems may also affect dental management include cleft palate or syndromes such as Down syndrome, Turner syndrome, and Williams syndrome, idiopathic hypercalcemia. Oral abnormalities can be associated with cyanotic congenital heart disease that may include delayed eruption of both dentition, primary and secondary permanent dentition, greater frequency of positional anomalies that have canine vocally or labially at other teeth, enamel hypoplasia. Teeth often have bluish white skimmed milk appearance, and there is gross vasodilatation in the pulse. Greater caries and periodontal disease activity, probably because of poor oral hygiene and lack of dental attention. After cardiotomy, transient small white non-ulcerated mucosal lesion of unknown etiology may appear. Thank you for your listening to this lecture, and continue in other